And hello, everybody. Welcome to Chapter 9. So, this is the joints chapter. It goes right along with our bones. So, Chapter 6, we learned about what bones are composed of, what bones are, how they're produced, some disorders associated with bones, factors that influence bone formation, and metabolism. In Chapter 9, we're going to talk about how bones work together. And so bones articulate with other bones to form what we call joints. And this figure shows an individual using her joints so that she can have body movements. Without joints, we couldn't move our bones at all. So because bones are really, really hard, they don't bend, though we do have the collagen fibers that allow for slight flexibility. They are not bendable. Bones can't just bend normally. And so the joints are where bones tend to articulate or move. And so a joint or an articulation is a place where bones contact each other. Sometimes they contact each other, sometimes they will contact cartilage, and sometimes bones contact teeth. The joints are classified structurally by what they're composed of and functionally by how they move. So we have three structural classifications of joints. A fibrous joint is composed of dense, regular connective tissue, and fibrous joints have no joint cavity, so it's this dense, regular connective tissue that holds two bones together. Examples are the sutures of our skull, as well as our facial bones. And so lambdoid suture is the suture that articulates between, or that allows for the articulation between the occipital bone and your parietal bones. Cartilaginous joint is a joint that is attached to that attaches two bones together by cartilage. Again, no joint cavity. The type of cartilage is either going to be hyaline cartilage or fibrocartilage. The example here is the intervertebral disc between our vertebrae, and that would be a fibrocartilage joint. And then we have our synovial joints. Synovial joints have a fluid-filled synovial cavity, and this joint articulates between bones that that are movable, and has multiple safety measures associated with it. So we have tendons that attach the bones together that can also protect the joint, and then we have ligaments that are holding the bones together, bone to bone, and protect joints as well. And so the example here is the humeral ulnar joint or elbow joint. So functionally, we classify joints by how they move. So a synarthrosis is an immovable joint. There are two groups of joints that can be synarthroses. Fibrous joints can be synarthroses, and cartilaginous joints can be synarthroses. Synovial joints are never synarthroses. So the example here that I have is the tooth and jaw joint. That's called a gomphosis, and that is a synarthrosis. It's also a fibrous joint. Amphiarthroses are slightly movable joints. So there's minimal movement, but there is movement. Again, these can be fibrous or cartilaginous, and the example here is called a syndesmosis between the tibia and fibula, also between the radius and ulna of the forearm. We have another syndesmosis, and this again is a fibrous joint. Diarthroses are freely movable joints, and these are all of our synovial joints. So only synovial joints are freely movable or diarthroses, but all synovial joints are diarthroses. The example here is the knee joint or the femorotibial joint or tibiofemoral joint, however you want to say it. So let's look a little bit closer at some of these joints. Here's a suture, so you can see the squamous suture right here, the lambdoid suture right here. We have the coronal suture here, and there's actually another suture right here called the sagittal suture that you don't see. These are all immovable joints. They're all fibrous joints. This is the intervertebral disc that we talked about. This is a cartilaginous joint. It is an amphiarthrosis composed of fibrocartilage. There's slight movement between this joint or within this joint. Here's an example of a freely movable joint. So this is a pivot joint. And right here, this is a ball and socket joint. Ball and socket joints as well as pivot joints are freely movable. And these joints allow or are synovial joints. So, okay. So here are the three types of fibrous joints that we have then. So this one here is called a gymphosis. It is a tooth and jaw joint. So we have a gymphosis between the teeth and the mandible and the teeth and the maxilla. The ligament that helps to hold this joint together is the periodontal ligament. The joint is a synarthrosis, so there's no movement, and we don't want movement between our teeth and our jaw. Over here we have the suture, which we talked about already, again a synarthrosis. And then this is a syndesmosis. This is between the ulna and radius here, but we also have between the tibia and the fibula. But this is actually the ulna and the radius, so that's what these bones are. And it's this joint between those two, this fibrous tissue, that's called a syndesmosis, a slight movement between these two bones, so you can move them just a little bit. And here you can see the fibrous joints also here. You have that, you don't see it again, but there's a squamous suture. You still have that suture line there. You have a suture line here. And then you have these fontanelles. These fontanelles are also fibrous tissue, and eventually they will fill in with bone. They'll become osseous tissue, and you'll have that fully formed squamous suture. Okay. Or I said fully formed squamous suture, but fully formed sutures all the way around when these soft spots, these fontanelles, fill in with bone or become bone. Cartilaginous joints, we have two major types of cartilaginous joints. They are structurally and functionally different. So we have two types of cartilage that make up the joints. Hyaline cartilage makes up a synchondrosis. And so here's an example of hyaline cartilage making up the synchondrosis. The epiphyseal plate is a synchondrosis. Another example is the costal cartilage that holds the ribs to the sternum. That's a synchondrosis. It's composed of hyaline cartilage, and it is a synarthrosis movably. So it has no movability at all. Synarthroses, immovable. Hyaline cartilage, synchondroses are immovable. And then we have fibrocartilage symphyses. So this is the pubic symphysis, and you saw before the fibrocartilage intervertebral discs. These are amphiarthroses functionally. So they're composed of fibrocartilage, and they have slight movement. The joints that we're going to focus on in this chapter, though, are called your synovial joints. Synovial joints are the joints that are found found around all freely movable bones. So this is just a generic synovial joint, but we have free movement. There's a synovial capsule that has synovial fluid. The synovial capsule has a fibrous layer or a cellular layer, um, and a cellular layer. The cellular layer is what produces the synovial fluid, and the synovial fluid then fills this capsule and protects the bones. So it acts as a shock absorber, but it also nourishes the cartilage, because cartilage in your synovial joints does not have a perichondrium around it. So the um, articular cartilage around the ends of the bones has no perichondrium. It gets its nutrients from the synovial fluid here, and it helps the joints move more freely and easily. There's a lot of structures associated with our synovial joints, and we're going to look at each of them, okay? So I mentioned some of this already, but synovial fluid acts as a lubricator to help the bones move past each other easier. It nourishes the cartilage, so it feeds the cartilage, gets rid of waste from the cartilage, and it acts as a shock absorber. So the bones don't hit each other when there's compression occurring, when something, causes compression. Associated with our synovial joints, we have ligaments and tendons. Ligaments are dense regular connective tissue that attaches bone to bone. And so here's an example of a ligament. They attach one bone to another bone. Tendons are dense regular connective tissue that attach muscle to bone. And again, these also help to stabilize joints. Both of these stabilize joints. Both ligaments and tendons are composed of dense regular connective tissue. Dense regular connective tissue has collagen fibers that run in one direction, so they protect the joint very, very well in one direction along that ligament or tendon. And then we have bursa. Bursa are fluid-filled sacs of synovial fluid that are found surrounding and within joints. So like right here we have a bursa that protects that region of that joint. Tendon sheaths are elongated bursa that wrap around tendons. We see these typically in our wrists and ankles in areas where there's a lot of friction, so where we have a lot of tendons running right next to each other so that the muscles can move the body, but to protect the body from too much friction. And then we have these fat pads that kind of act as fat packing material within the joint. And so this is just a bigger picture of that same picture that was on the other slide, but you can see the words a little bit more effectively here. So synovial joints have 6 basic types of movement. The more movable a joint is, the less protection it has, the less stable it is. So your most movable joints are going to be the least stable joints, if that makes sense. So we have pivot joints that allow for rotation around some certain axis. An example of a pivot joint would be the atlantoaxial joint that allows us to shake our head no. That would be an example of a pivot joint. A hinge joint is a joint that works on one axis, so these are both just uniaxial joints. A hinge joint is going to allow the bones to move on one direction. Hinges typically allow for increasing or decreasing the angle of a joint. So an example of the hinge joint would be the humeral ulnar joint, allowing us to move our forearm or our hand to our shoulder. A saddle joint, we only have two saddle joints in our body, and a saddle joint is a joint between the metacarpal of the thumb. And it is it's more of a multi-axial joint. It allows for a lot of movement. So you have flexion, extension, but you also have adduction, abduction, and you have circumduction of that joint. A planar joint is a joint that allows for gliding movements between bones. Planar joints are found between the carpals of the hands and the tarsal, or the carpals of the wrist and the tarsals of the ankle region. A condyloid joint is, again, a biaxial joint that allows for movement on two planes. So a condyloid joint would be a joint between the first, did I say first? The metacarpophalangeal joints and the metatarsophalangeal joints, allowing our fingers to move out as abduction, adduction, and bend or as a hinge joint to wave high, to kind of say hi, hi. Okay. And then we have our hip or shoulder joints, which are ball and socket joints of the body. The shoulder joint is the most movable, which means it's also the least stable joint of the body. Okay. So there's a lot of different movements that our body makes depending on the joint. So we're going to look at each movement. You do need to know these movements, and I do have a video for the movements that hopefully will help you. But as I'm talking, do the movements with me. Okay, so I'm doing the movements at my house. You should do the movements wherever you are. Unless you're in the car listening to this, then don't do the movements. Wait till you pull over and you're somewhere else where you aren't going to get into an accident, and then do the movements. Okay, so we have flexion and extension. This is flexion and extension occur on hinge joints. So we can flex, which decreases the angle of a joint, and extend increases the angle of a joint. Hyperextension occurs when you extend further than 180 degrees. So think about your knees hyperextending. If you've ever done ballet, then you know what I'm talking about. Knees tend to hyperextend. Another hyperextension would be when your head looks up as if you're looking in the sky at a plane. That's a hyperextension, okay? Then we have, I'm trying to see, I want to make sure I'm doing this. You can flex and extend lots of different regions of the body. We have lateral flexion, lateral extension, where you're flexing your torso to the side and then back up, okay? The next thing we can do is we can, and I'm making sure, circumduction I don't want to talk about yet. I want to do abduction and adduction. Abduction is moving the body away. So moving something away from the body. So if you are abducting, you're moving your arm away from the body. If you're abducting your fingers, you're moving your fingers away from the middle finger. If you are adducting, you're moving them back into the body. You're adding them back. You can adduct your legs. You can adduct your arms. You can abduct those things as well. Circumduction then is flexion, extension, abduction, and adduction kind of all together. So it's like you're making a circle of the body region. So think about use like if you were to have a hula hoop on your wrist and you're trying to move it around and you're swinging your arms up around and around and around, that would be circumduction, okay? The next movements, supination and pronation. These are special movements of the arms, the forearms. So as the radius and ulna move past each other in a pivot movement or on a pivot joint, we can turn our hand so that it either is pronated where the palm is face down or supinated where the palm is face up. Think of supination, you're holding a soup bowl and it's face up. Pronation, you spilled the soup and now your hand is down. Okay. Plantar flexion and dorsiflexion. Plantar flexion, your toes are pointing towards the ground. Your heel is lifted in the air. So your toes are pointed towards the plantar of the foot. Dorsiflexion, the toes are pointed up and towards your tibia. And so that'd be like heel walking, plantar flexion, walking on your toes. Inversion and eversion. Eversion, you're rolling your ankle outwards, so laterally. Inversion, you're rolling your ankle medially, so you're pointing the plantar of your foot to the midline of the body. With eversion, you're pointing the plantar of the foot away from the body. Protraction and retraction. So this is kind of fun. Move your, kind of loosen your jaw, just let it sit, and now push your jaw outwards, your lower jaw, because obviously no one can move their maxilla. The only movable bone of the face is the mandible, so push the mandible out. Kind of like you have a really bad underbite. Ooh, ooh, ooh. That would be protraction. Retraction, bringing it back in. And so I'm making the noise because you can't see me, so I'm actually doing it, but I'm making noise while I'm doing it. Elevation and depression. Elevation, if your mouth is opened and you shut it, that's elevation. You're moving your jaw back up. You can elevate your shoulders in a shrug. Depress, push the shoulders down or open the mouth. Elevate, depress. Elevate, depress, okay? And then opposition and reposition. Opposition, your thumb touches all the fingers, okay? So the thumb touches your first digit, second, third, and fourth. Reposition, it goes back, brings the thumb back to the index finger. So opposition to the pinky, reposition to the pointer. Opposition, reposition. And actually, okay, right here, I have an awesome song. If it does not play, I want to play it for you because it's so amazing, okay? If it doesn't play, look it up on the internet, okay? It's super fun. I'm going to play it here, but if you can't hear it, if it doesn't work, then just look it up because it will possibly help you in memorizing those movements if you struggle with the movements of the body, okay? I thought it was an amazingly well done video. I'm going to shut up, don't worry. So if you don't hear it, stop my video and just look for the song. It's super simple. It's on YouTube.
Man, I'm showing y'all the movements, movements, movements. Listen to me. Man, I'm showing y'all the movements, movements, movements. That's what you'll see. Anatomical movements, movements, movements. Anatomical movements, movements, movements. Yeah. Back up in the mix like that to show you what I mean so you won't fall flat. These terms that you need to get you up to speed. The words are at the bottom, you can listen and read. First things first, you should lift your wrist, then decrease the angle, something like this. When you do that, you could call it flexion. Increase the angle and that's called extension. Now, put your hands by your side, rotate your thumbs so they face outside. When the thumb points out, lateral's how it's facing, and when it points in, it's medial rotation. Movements, movements, movements. Listen to me. Man, I'm showing y'all the movements, movements, movements. That's what you'll see. Anatomical movements, movements, movements. Anatomical movements, movements, movements. Put your arms out and move them round, round, round. Circumduction's moving round, round, round. There's a few terms left for a discussion. Arms by your side, moving away is abduction. Now keep your arms out, and when you move them back in, that movement there is adduction. These next two movements you're really gonna love. You can do them in the club, looking like a shoulder shrug. Remember this song next time you're with the patient. Lifting up your shoulders is called elevation. Opposite of that is what's next in our lesson. Lowering your shoulders, that's called depression. Last one is supination with the palms up. Pronation's when it's facing down, that's what's up. Movements, movements, movements. Anatomical movements, movements, movements. Next up is something funky, sorta neat, cause we gotta talk about some movements of the feet, yeah. That's how your feet be working, roll your foot so it angles out and that's eversion, yeah. And when you roll it back in, that movement there is inversion. The next term you'll learn is something you use often. It's the movement you'll do if you're ever moonwalking. If you're picking up just what I'm putting down, lift your foot up and point your toes towards the ground. If you're unsure of the term and left guessing, bottom of the foot is plantar, the move is plantar flexion. Put your foot down and leave it like it's resting. Lift your toes off the ground, it's dorsiflexion. And that's it, all the terms you need. Just remember this song and you're sure to succeed.
So I hope you did enjoy that song. Where is I'm gonna stop it here. There we go. Oh, okay, I'm gonna stop it again. There we go. All right, I'm gonna stop the video and I will post this video on YouTube for you to watch. And I will finish this lecture in the next chapter or in the next video that I have, okay? Have a great day. Bye.